Hi, I'm here with Sim. She's been successful at obtaining a run-through ophthalmology post in England. So we're just going to talk to her about the application process to date. So firstly, congratulations on getting your post. So if you could summarise for us, what was the application process?
It starts off with registering on Oriel, which is the national recruitment website, and you have to create an account on there, which then later allows you to fill up the form once the application process begins. It's also the account that you will use to book your specialty recruitment assessment tests, book your interview date, and also you find out the results of your interviews on there, and you rank your jobs as well as accept or decline your offer once you get it. So everything's pretty much done online.
So when do you register?
The registration usually takes place around about November time each year, and the dates vary slightly from year to year, and it can be found, the information can be found on the 7 Deanery website for ophthalmology, ST1.
Okay, and then what happens after you've submitted an application form?
So after that you wait for the outcome based on your application. As long as you filled in your form correctly and given them proof of your MBBS degree and your completion of a foundation program, those are the minimum requirements, just so that you're eligible for the application process. Then you get an invitation for doing the exam, which is the specialty recruitment assessment. So once you've done the online form, you then get an invitation for the test.
So the form at that stage is just sort of personal details?
Mainly just personal details, where have you worked before in the country. The form asks you to list some references, so it's a good idea to contact previous consultants that you've worked with in advance, just to say I'd like to put you down as a referee, and just collecting copies of documents like your foundation program completion certificate and your MBBS. Usually that's about all that you need really at that stage.
And then tell us a bit more about these special exams you have to do now.
So it's called the Specialty Recruitment Assessment, and it's been rolled out for a few specialties at ST1 level. So candidates interested in applying for ophthalmology, all candidates have to sit for this exam, and if you pass, achieve a certain percentage in the exam, you then are eligible for being invited to the interview. So it's quite crucial to make sure you pass this exam, because if you don't, then you won't get invited to the interview.
And can you prepare for this? Should you do some reading? Or?
Yes, yeah, absolutely. There's lots of resources available, lots of question banks, online question banks like Past Medicine, Past Test, to name a few. There are also books produced by, I think, Past Medicine on specialty recruitment assessment. I used an online question bank, and I also used actually the GP specialty recruitment assessment book just to practice the questions for the exam. And it was both very useful.
How much time do you think you need to study for these?
I think at least a couple of weeks, because depending on what specialty you're working in at that time, you might be quite busy, you might not have enough time to do the prep. So I think it's good giving yourself a few weeks, a minimum of 2 weeks perhaps, I would say, because half the test is clinical based questions, so stuff that you would have covered in medical school, at medical school level up to sort of F2 level, but the other half of the test is the professional dilemma questions, which can be quite tricky if you haven't done enough practice. So the more you do, the better you get really at that test.
And where do you go for the test?
There are centres all over the country, and it's just a matter of putting in your postcode and finding the closest centre towards you. They're normally conducted in sort of Pearson VUE type of centres, the type of centre that you would go and have your theory driving test done. Yeah.
Okay, so do you get the result there and then, or how do you know you've done well enough?
Yes, so after doing the test, so the online application sort of takes place in, say, perhaps November-ish, December, and then the specialty recruitment test will happen in early January, and then you find out about 2 weeks later your test results, and at the same time, if you've done well enough, then they say, right, you're now able to go and book an interview slot. So about 2 weeks after the test.
What do you have to do in preparation for the interview?
Yeah, so again, all of this information is based on the 17ry website. It tends to change from year on year, so I would advise, the candidates that have done the interview, say the year before, who are reapplying, to just double check the website, because they do make slight changes to the interview every year. It consists of 2 parts, Station A and Station B, both of which then subdivided into 2 further parts, so in total there are 4 stations. The first station that everyone goes through is the critical appraisal and clinical audit station, and then there's a bit of a break in between, a 5-minute break or so, and then you go on to Station B, which is your communication skills and clinical skills scenario.
Okay, and did you have to do any preparation for the interview?
Yes, definitely. I started preparing for it pretty much on and off before doing the specialty recruitment assessment, but mainly after the specialty recruitment assessment test was over. I wouldn't recommend waiting for your results to know whether you have been offered an interview or not, just because there's only 2 weeks from knowing that you've got the interview to actually doing the interview, so it's best to just start preparing straight away, as preparation really is the. But I started with a critical appraisal and have a format on how to appraise papers, and I would try and do a couple of papers a week. And then in terms of the audit station, again, just going over some basic definitions, trying to give myself sort of problem scenarios and decide how to sort of design an audit to solve that problem, for example, because that's sort of what they want to ask. For the clinical skills, it's just really, they just want to know that you know your basics. They're not looking for too much sort of in-depth knowledge about ophthalmology, just simple basics of ophthalmology which relate to other specialties. So thinking about like pituitary tumors and how it might be related to endocrinology. They want they want you to know a little bit about diabetes, how it affects the eyes, blood pressure control, myasthenia, thyroid eye disease, just eye conditions that are related to general medicine. And they give you a range of, this year there was a video showing some clinical signs which they asked you to describe, and then the questions went on from there as to what the cause of the etiology might be for the condition and how you would investigate it, and a few questions on what you might see on an MRI perhaps. There was an image on visual field tests, and a couple of fundus photographs, so it was relatively easy to get through if you had done a little bit of revision. And then lastly, the communication skills scenario just involved a simulated scenario with an actor, and you're given the scenario beforehand. The time is quite short, so preparation again is really key. Just practice with your colleagues, practice with anyone else that's also doing the interview, just to make sure you try and cover as much as you can within those 6 minutes.
Okay, and did you have to take a portfolio with you? Evidence?
Yes, yeah, you do. You take your portfolio when you on the day of the interview, and you submit it to the panel before you go in. So your portfolio is being marked as you are going through the interview stations. And again, there is a guide on the 17ry website on how you should format your portfolio, and they are very specific and very detailed, so you should follow that as much as possible, because there's 5 marks allocated to the presentation of your portfolio, which includes how neat and tidy and well organized it is, and how easy it is for someone to look for what they're searching for in your portfolio. So it's 5 easy marks to get, so it's worth spending some time on preparing a portfolio beforehand, even before you register on the Oriel website, way before the test. I started getting my portfolio ready about maybe 4 months before the actual interview, so end of October, early November-ish, just because it can take time if you're having to write emails to people to send you certificates that you didn't think of collecting in the past. So yeah.
So obviously you need things to be putting into this portfolio. When do you think you started in your medical school or working career that you actually started working towards showing your interest to ophthalmology?
Yeah, so as soon as I realized that I wanted to do ophthalmology, which was towards the end of medical school, was when I, thought I needed to start, doing things for my CV to help me get the ophthalmology job. So I started off, at a medical school level with doing audits, electives, placements, and then trying to secure, and I did manage to get an F2 job in ophthalmology as well. And I just started from basically medical school. At that time I didn't know exactly what was needed in the portfolio. It was only later on in foundation when you think that you're actually going to be applying that you look at what's required.
So after the interview, how long do you have to wait before the result?
It's about 3 weeks from when you finish your interview to the day of the results.
And that's all informed on
Yes.
the website?
Yeah, it is.
And then do you have to rank areas in the UK to work, or when does that happen?
Yes, you do. You do that after you've done your interview. So about a couple of days or about a week after the interview is over, they invite you to rank all the deaneries in the country, and that they give you about a week to do that. And then as soon as that closes, a week later is when they release the results.
Okay, and would you have any suggestions? Would you do anything again differently to anyone that thinks about applying to ophthalmology training in the future?
Just be as much prepared as you can in advance. Be really organized. You don't, 3 weeks before the interview, you don't want to be still, halfway through filling your portfolio. Just get as much done in advance as possible, so that towards the end you're just, solely focusing on the interview, knowing that you've already secured your portfolio and done the best that you can for that, because they're both equally important. So you can't just rely on having, a brilliant portfolio and full marks, because if you mess up the interview, then you're not going to get a job anyway. So I would say just give yourself as much time in advance and be as organized as possible.
Okay, because then it will be worth it in the end.
Yeah.
Okay, well, thanks for letting us interview you today.
Thanks, Amy.
And good luck with your future career now.
Thank you.